Good afternoon. My name is Waldon Garriss. I'm an internist and a pediatrician at Vanderbilt University. I'm professor of medicine and pediatrics there and chair of the SMA Education Committee. I have not been able to stop smiling since I got the agenda and realized that it was going to be my chance to introduce Sal Mangione today. Sal is a clinician-educator and associate professor at Jefferson Medical College. He directs the physical diagnosis course and coordinates the history of medicine series. He's the author of The Secrets of Physical Diagnosis or Physical Diagnosis Secrets. And I'll just have to take a personal brief time to say he's also a muse, a mentor, and a dear friend. He's going to present today The Fluff of Medicine, Intangibles that Make a Difference. Please welcome me and join me in welcoming Sal.
Thank you so much, Dr. Garriss, and thanks to the president for inviting me. This is a paper I have no conflicts of interest with, and it's indeed based on a paper that just came out in Fairs this summer. And the premise is that fluff, intended in the sense of the Flemish term for the lint of fabrics that needs to be discarded, in medicine is actually not rubbish, but it's the intangibles that make the difference. And frankly, you don't really realize that until you move to the other side of the fence, you become a patient, or unfortunately, you have to deal with family members that become patients, and you see doctors from the other side. So we're talking about the difference between healers and technicians. So we're going to be talking about professional identity. And of course, it's a personal view. It's a personal view because I'm becoming an old geezer, a curmudgeon. It's 50 years since I enrolled in medical school, and I just turned 70. So I've reached that part of life when each of us has to lower sails and gather in the ropes and look back at the journey. So my area of interest was, believe it or not, physical exam. So I wrote quite a few papers on it. I got my bearded picture on the front page of the science section of the New York Times. I wrote a book, as Dr. Garriss said, but more importantly, I got to meet all the people that still value this, and they are like an endangered species. They practice it, they do it, they cherish it, and I came to realize that the stethoscope is a metaphor. It's a metaphor for a totally different way of being doctors. It's the tip of the iceberg for what I really would call the art of healing. So back to Osler. Medicine is an art that uses science, but it's much harder to acquire the art than the science. And that makes all the difference. And it's hard to put in words, but it's one of those things that you know it when you see it. So since language fails us, I would like to resort to visual right brain. And I'm going to show you three famous paintings that convey exactly what I'm talking about. The first one is called Science and Charity, and was painted by a very young Pablo Picasso. Now, Picasso had just lost a baby sister to a bout of diphtheria, and it was a painful death because the antitoxin was available and the family could not afford it. So he juxtaposes the rational, cold, and expensive detached way of new medical science with the compassion of the nun, who's taking care of the baby and offering a cup of warm milk to the patient. And the patient is touched, and the two connect through empathy. Now, what Picasso had been inspired was this other painting that had come out a few years before, also by a Spaniard, that was appalled at how the new medicine was reducing patients to mere sources of clinical information for the benefit of trainees. And so they were trying to remind us not to abandon our heritage now that the new scientific medicine was finally winning the day. And this was on the minds of many visual artists, including, I'm sure you must have seen this one, Sir Luke Fells, who in London painted the Doctor in 1887. And of course, the protagonist is a Victorian physician. Now, it's curious because when you look at what the public associates with our profession, this guy is missing all the four implements that the public associates with us. It doesn't have a white coat. The Germans hadn't invented it yet. It doesn't have the reflective mirror. It doesn't have the stethoscope. It doesn't have the black bag, but it got pietas, caritas, humanitas, gravitas. And of course, the parents of the little child are in awe. Now, Fels had come to this painting through a personal ordeal. 14 years before, he had lost a baby boy to a bout of scarlet fever on a Christmas night. And he was so touched that by this Dr. Murray that spent the night with the child, even though could offer him very little. A few concoctions he had prepared himself, but primarily offered himself. And this became so iconic that immediately the British Medical Journal wrote an editorial. What don't we owe Mr. Fels for showing the world the typical doctor as we would like to be shown, an honest man and a gentleman doing his best to relieve suffering. A library of books in our honor will not do what this picture has done and will do for the medical profession in making the hearts of our fellow men warm to us with confidence and affection. Okay, so that's 1893. Fast forward 100 years and you get him. And this is Dr. Jed Hill, who's the doc with a God complex.
You ask me if I have a God complex? Let me tell you something. I am God.
All right, so point of this, please, whatever you do, don't become an asshole. And unfortunately, that's how Hollywood portrays us. This is a very interesting paper I ran a medical cineforum at Jefferson, where they reviewed 131 movies where physicians were portrayed between the 1920s and the 1990s. And the positive portrayals have been going downhill ever since, with negative portrayals going up. Also, what has gone up a lot is the portrayal of the physician as a jerk, but with potential, which basically means gets his cancer and sees the light. And that's the famous movie, The Doctor, that came out a few years ago. So the question is, again, how did we go from him to him? And I think the explanations are many. Technology is interfering, and good luck with new technology where you don't look at the patient and AI will run the show. Lewis Thomas blamed the demise of the humanities, and I kind of agree with them. And Bernard Lown, Nobel laureate for peace, but also inventor of the defibrillator, basically said we lost the art of healing, which goes back to Osler. Now, the public isn't happy, so attacks on physicians are common. My own medical school had to put a metal detector in the hospital, which says a lot more about us as a society than medicine in general. But it's not only the US, because attacks on physicians are everywhere. These are a group of Italian doctors. They had to barricade themselves in the hospital to fend off attacks from angry family members. So forget about him. He's gone. We've lost the art of healing. And now that we're going towards a medicine based on AI, good luck with that. So the question then becomes, what are the ingredients that make that healer? And this is a question that was answered by Edmond Pellegrino in a paper published in JAMA 50 years ago. And he boiled it down to 3 C's. We got to be competent, otherwise we're going to be quacks. We got to be compassionate, otherwise we're going to be Nazi doctor. But more importantly, we got to be cultured. And this is where it gets tricky. So it's only in the overlap of these 3 C's that comes the physician. Now, of course, everybody agrees with competence, but what about compassion? We don't even know how to name it. Empathy, sympathy, compassion. Jefferson, where I work, has created an empathy scale that got translated into 60 languages. But frankly, my favorite definition of empathy comes from this movie.
Lei avrebbe meritato un 28, un 29. E ho messo 30 perché ho applicato quello che chiamo il quoziente di simpatia. Poca cosa, ma quanto basta per farla arrivare al 30. Qualcuno prova da eccepire su questo mio quoziente di simpatia, ma io credo che la simpatia, nel senso greco del termine sympasein, cioè condividere il pathos, la sofferenza altrui, è molto importante per un medico. Ad altri applico invece il quoziente di antipatia, cioè tolgo 2, anche 3 punti. L'antipatia è la cosa peggiore per un medico.
Now, it's pompous, of course, but the point is valid because 2,500 years ago, Hippocrates reminded us that many times, despite the severity of their conditions, patients do get better through their contentment with the goodness of their doctor. And the reason is that that connection unleashes the placebo effect, which is a fact. Now, Howard Spiro, that ran the medical humanities at Yale for many years, used to quip that the placebo effect reminds us that we still have cousins out there who are witch doctors, shamans, and all kinds of things. And doctors just don't like to admit that. Now, what you don't really want is to trigger a nocebo effect. That's why, really, you don't want to become a jerk. Now, how do you connect? Well, you connect clearly through empathy or compassion or sympathy, but you can connect through culture. So let's come to this point because this is where it gets tricky. Culture is almost radioactive nowadays if you think about a doctor. Now, 100 years ago, Osler gave a speech in Oslo, in Canada, where he articulated the 4 main traits of our craft. And he says, well, first of all, we're not a religion. We are an art based on observation and science. And we have a moral code based on the Hippocratic Oath. But lastly, the conception that medicine has to be the profession of a cultivated person. Now, Edmund Pellegrino himself reminded us that we're not talking about better dinner party conversationalists. We're talking about humanists. Medicine is the most humane of the sciences and the most scientific of the humanities. And that makes sense. We're not taking care of carburetors. We're taking care of human beings. So years ago, I did a study, and we surveyed 5 medical schools. One was actually Tulane here in New Orleans, and then there was OHSU and Brown, and in the Delaware Valley was Cooper and my own Jefferson Medical College. So we surveyed the entire student body. And we got 740 kids to answer a very lengthy questionnaire where we asked them, how much do you do in the humanities? Do you paint? Do you draw? Do you sculpt? Do you play a musical instrument? Do you write poetry? Do you write essays? Do you act in theater? And then we came out with a score and correlated with all those traits whose absence we lament in today's medicine. And lo and behold, kids that did more in the humanities were more empathetic, they were more comfortable with ambiguity, they were less likely to burn out, and they were wiser. Now, we're talking about wisdom, and wisdom is very different from knowledge and information, which is what medical school obsesses about. How do you create a wise physician? And Socrates put it very simply, knowledge without wisdom is dangerous. So I think you get it out of life, because life knocks you around, and maybe a couple of things you learn them in life, and you get them by life through proxy, which is a liberal arts education. Now, in Europe, this was a prerequisite for admission until the 1960s, prerequisite for admission in medical school. Now, Anthony Fauci was a product of that education. So was Bernard Laun, inventor of the defibrillator. So was Rudolf Virchow, who single-handedly invents pathology, but the guy is also a polymath. He speaks 7 languages, reads Greek and Latin, and writes more papers in anthropology and archaeology than in medicine itself. So when we talk about culture, we talk about a humanistic and eclectic culture as the prerequisite for wisdom, which brings us back to him. I called it gravitas, but it's wisdom. Now, the gravitas of a compassion and culture healer requires, and here I want to emphasize this concept, that we reject this horrible term. So let's spend a few words about the fact that here in this country, we've been downgraded to providers and doesn't exist in any other country. Now, in 1965, Johnson's passes Medicare. There are not enough physicians to take care of the previously uninsured patients. So what they should do, they should create more doctors. Instead, what they do, they take doctors from abroad and they create extenders. So the first school for physician assistants and nurse practitioners opened in the US in 1965. And it's an American phenomenon. Now, they're going to call them something, so they call them providers. And the term in Medline appears in the 1970s and then gradually expands and gets extended to everybody. In the past decade, exploded to 12,000 entries. Now we are all providers. And it's an American thing. The BMJ has never used it. But in this country, it's very much used by the internal medicine literature. Curiously enough, the family doctors have been very resistant to anything demeaning of their professional identity, to the point that two family medicine academics wrote that maybe misformation of professional identity, which basically means being called providers, is responsible for burnout. Now, I'm very interested in how language guides the way we see the world. Nomen est omen, my forebears used to remind us. Names are signs. In the Bible, the name of someone means the character of the person, to the point that that name can only be changed by divine intervention that changes the character of the individual. So I wrote a paper titled The Naming, where I looked at how they name us in other languages. And I looked at Arabic, Hebrew, and Hindi, Urdu, Farsi, Old German, Old English, German, Greek, and Latin. And lo and behold, in every of those languages, a doctor is a wise and cultured societal leader, blessed with almost divine healing powers. Which brings us to how in the world did we get that? And we got it because of money. It's all money. Mostly because this allows us to outsource. So if you go to an emergency room now, I was in an emergency room in Philadelphia, I had some problems, and I got seen by a provider. And then I prompted her and I said, who are you? She was a nurse practitioner. I didn't get seen by a doctor. And if you go to California, it's almost entirely now staffed by providers because they cost less. Now, I'm an intensivist, and I can tell you that a pulmonologist running an ICU, before even starting to see patients, has 13 years of training. A nurse practitioner and a physician assistant has 5 to 6, but they cost 1/3. And that's eventually what's going to happen. So with the chief of medicine at the Cleveland Clinic, we wrote a paper rejecting this that got us a flood of congratulatory emails, but more importantly, got a position paper by the Association from Family Medicine Residency Directors, where they basically said, we're not going to use providers anymore in official communication. We're going to say physicians. And more importantly, we implore anybody who reads this paper to please do the same. Now, these are the family doctors. Why internists haven't done it yet? It's mind-boggling. Now, second reason, the term is radioactive. The first to introduce it were the Nazis. So when Hitler took over, half of his pediatricians were Jews. And he was not going to have the Jews to take care of the future master race. So he told them to resign, which they didn't do. Then he told the German Medical Association to demote them from Arzt, which is German for doctors, to Krankenbehandler, which is German for provider. And then he sent them to the camps. So beware of language games. Orwell spoke about newspeak, and medicine is awash in medical corporate newspeak that is driven by money. And frankly, the best pushback didn't come from one of us, came from a Nobel Prize-winning economist. Paul Krugman wrote in the New York Times, patients are not consumers or clients or customers. The idea that all this can be reduced to money, the doctors are just providers selling services to healthcare consumers, is sickening. And the prevalence of this kind of language is a sign that something has gone very wrong, not just with this discussion, but with our society's values. So yes, of course, we need to reject the whole idea that it's a healthcare industry. And if we call it an industry, then we shouldn't be surprised if they shoot at us. This was the famous CEO, of course, shot by somebody with my last name, by the way, no relation. And of course, the AMA telling us, prepare for attacks. So no, we're not providers, or at least we don't only provide medical care. Frankly, I like doctors because it's Latin for teacher, but also it's Latin for a cultured person, a wise person, which brings us back to the original one, okay? So let's revisit the cocktail. Pellegrino gave us 3 ingredients. I would like to expand on culture and compassion and bring in this fluff To me, the fluff, the intangibles, are 7 traits, and they're going to be compassionate touch, eye contact, attentive listening, empathy, tolerance for ambiguity, self-deprecating humor, great to kill narcissism, and then, of course, connect with the patient. And finally, I think we do need a philosophy of life that is conducive to wisdom. Galen says the ideal physician ought to be a philosopher. All right, so that's what I mean by compassion and culture. And in fact, this talk was commissioned by the Italians for a talk in Turin that was titled, Be Your Patient's Favorite Actor. Now, they're not saying something weird, because the BMJ wrote an editorial about the fact that medicine is a performing art, which brings us to the shaman. Folks, there is absolutely nothing bad at cultivating the shaman within, as long as you're competent. And I'll give you an example. William Osler, one time when at Oxford, was coming back from a graduation, and a colleague says, William, my child is dying of pertussis. You love kids. Would you come in and cheer him up? Osler was still in regalia. So he went to see the kid, 4-year-old, dying of pertussis. Examined the kid from top to bottom, laying on the hands. Didn't say a word. And then got a peach, peeled it, sliced it, sugared it, and fed it to the kid, and then left in silence. Every single day for the next 40 days, he went back in regalia. Grabbed a peach, sliced it, peeled it, sugared it, and fed it to the kid, and the kid got better. So I asked my wife, who went through 3 years of medical ordeal, and she's a family doctor, trained at Cornell and Columbia. And I asked her, Gretchen, who's the ideal physician? And she gave me this beautiful definition. The ideal physician is the one who can unleash the patient's self-healing energies. And it starts by touching them. Good luck in this country where we don't touch. Let's talk about that. We don't touch because they sue us, to the point that physical exam has gone the way of the dodo. In many institutions now, they give you a chaperone for non-sensitive part of the exam. And good luck with physical exam now that we do telemedicine. Now, that creates a demise of important clinical information, but more importantly, it prevents us from touching patients. And I wrote an editorial in JAMA on how we don't. And that editorial was prompted by this picture of my grandkid, whose name is Luca, protector saint and patron saint of physicians and artists. By the way, we have the same patron saint, which tells us that medicine is an art that uses science. And Luca was at daycare, and this little girl started crying, and he went there and gave her a hug. We are wired for that. Then society kills it. Now, Louis Thomas wrote quite a bit about touch. Touching was the real professional secret, never acknowledged as the central essential skill, always obscure, but always busily there. The laying on of hands, there, I think, is the oldest and most effective act of doctors, the touching. I have a colleague at Jefferson, actually had him because he went to Penn, Italian-American, Frank Leone. And at the end of every encounter with his patients, he gave them a bear hug, and they loved it. But we tell our kids to keep personal space, that there is a bubble around each of us and should never be pierced. And this spills over to the workplace. I was reported to the dean by a secretary claiming that I invaded their personal space. Of course I invaded their personal space. I'm Italian. Now, the study on this was done in Florida by Sidney Girard, who went to coffee shops around the world and counted the number of times the couples touch each other while sharing a cup of coffee. In Paris was 110 per hour. In London, never. Gainesville, Florida, 2 times per hour. Puerto Rico, 180. So, yes, I do come from a society where interpersonal distance is measured in microns. And this New Yorker editorial put it simply. Thank you for respecting my request for no physical contact upon greeting. We don't allow it until we get sick. And Louis Thomas commented on that. Some people don't like being handled by others, but not or almost never sick people. They need being touched. And part of the dismay in being very sick is the lack of close human contact. Ordinary people, even close friends, even family members, tend to stay away from the very sick, touching them as infrequently as possible for fear of interfering or catching the illness, or just for fear of bad luck. The doctor's oldest skill in trade was to place his hands on the patient. And why is that? Because you trigger a huge trove of biological results. Let me show you. If you touch people, you release endorphins, serotonins, oxytocin. You provide a sense of relaxation. You increase natural killer cells. You lower blood pressure. You decrease stress-induced cortisol levels. And ultimately, you modulate endogenous opioids, so you relieve pain. And that's why the royals of France and England for years lined up their subjects and healed them through touch. It was called the royal touch. But in our hospitals, we don't do it. This is a poet dying of AIDS who wrote a touching, no pun intended, editorial in JAMA, where she said, in the morning, doctors come over, do rounds, mispronounce my name, and don't touch me. And the nurses are not any better. So yes, please touch your patients. As Lim Carmichael, one of the founding fathers of family medicine, put it, the ideal doctor is a good groomer. Now, one of the reviewers for this JAMA paper I published wrote anonymously, my concern when speaking about these matters is that some people, particularly younger physicians, may see it as a nostalgic but impractical call to the halcyon days of Osler. I encountered this in my own practice quite a bit. In other words, they see it as fluff. By the way, the Fluff of Medicine paper that prompted this presentation got a flood of appreciative emails, and I Googled everyone who wrote. They were all older senior physicians. I didn't get a single one from a young doctor. They see it as fluff. Now, when my wife had to get the bulking surgery, we got him a Memorial Sloan Kettering. He walked, and he's a surgeon, so theoretically not very touchy-feely. He walked into the room, saw her, saw that she was scared, didn't even look at the computer, sat down at her eye level, looked at her in the eyes, grabbed her hands, and said, you're going to make it. You're going to do very well. And she got out of their office with a beautiful smile, and I bet a major boost in her immune system. Now, that's what doctor is getting rare. And nowadays, we don't even look at them because we have to look at the computer so we can bill more effectively. Now, half of our time during the interaction is spent looking at the computer and only 9% looking at patients. Now, that is a problem because it takes away the capacity to make instant diagnosis, which is what the Germans call Augenblick, an eye blink diagnosis. Let me give you an example. This famous picture by Nether of a pink puffer carries 16 evidence-based findings. I teach physical exam, if you can see them. But if you look at the computer, you're not going to see them. And moreover, the patient is going to be appalled by that. Why? Eye-to-eye interaction is fundamental for eliciting empathy. So let me tell you more about that, because that brings us to the issue of empathy. Now, tell me how engaged you are with this particular person as compared to this person that looks at you in the eyes. So that is an emotional connection. And the word authority on empathy is actually not at Jefferson, the guy who created the empathy scale, but is Simon Baron Cohen at Cambridge, who's written a beautiful book on how loss of empathy is the undercurrent of evil. So let's talk about empathy. According to him, empathy requires that I can read your emotions, and then I'm willing to act upon them. So I see you sad, and I want to help you out. It's a continuum. Down at the bottom, there are people that just don't have it, and down at the top, there are the super empaths. Who are the unempathetic, the ones that are irredeemable? According to him, the borderline, the psychopaths, and the narcissists, but also the borderline, the Asperger. And it's kind of interesting that Elon Musk told us that the fundamental weakness of Western civilization is empathy. That says much more about Elon Musk than about Western civilization. Now, the super empaths are St. Francis of Assisi, Albert Schweitzer, that can empathize with the universe. So the point is that you got to read emotions. So you look at the patient instead of looking at the computer, and you say, what's going on? I see you sad because you want to help. If you can't do that, you can talk to the person and say, you sound sad. What's going on? Because you want to help. But if the only way you can connect is through text messages, which is how the young generation now communicates, you're not going to develop an empathetic connection. If you do that from the time you're 10 years of age, 8 years of age, you don't even develop empathy circuits. Now, this is important because we live in times when we have screenagers that prefer virtual connection to face-to-face. Only a third in this survey recently done, they used to be 50%. And in fact, there was a study published from Michigan that showed a drop in college students' empathy that coincided with the decade when we introduced anti-social media and the iPhone. So we are in the middle of an anthropological transformation, and we don't even realize. And then good luck, because it's going to go into that direction. So I wrote a paper with Dr. Lockwood, the dean at the University of Tampa, and I think we need to work on it. And frankly, we live in times of cruelty. And I think the flip side of that is lack of empathy. And I think it's because we're going through an anthropological transformation. That is scary, because all evil derives from lack of empathy, the incapacity of one to understand and accept the likeness or difference of another. Empathy is fundamental for a healing connection with the patient. My definition of empathy is that person could be me. So you got to listen to the person. How long does it take before we interrupt the patient? 18 seconds on average. And Osler would be appalled. Osler told us, listen to the patient. He's trying to tell you the disease. Artists always did that. Hemingway, in his note, in a letter to a friend, said, listen now. When people talk, listen completely. Don't think what you're going to say. Most people neither listen nor observe. You should be able to go into a room, and when you come out, know everything that you saw there, and not only that. When you're in town, stand outside the theater and see how people differ in the way they get out of taxis or motor cars. There are 1,000 ways to practice. So listen and observe. I ran a course at Jefferson on the art of observation. We don't teach it. So how do you connect? You connect through eye contact, attentive listening, compassionate touch, and that kind of connection is empathetic. Makes a difference in outcome? Yes, it does. Study from Jefferson, they studied 1,000 diabetic patients. The ones that were followed by more empathetic physicians had much better outcome. All right, now let's move to the fact that life is full of grays. It's not a black and white thing. And that brings us back to my wife. So 2 years after this ordeal, I had to take her to Venice. And everything was planned. We had tickets, the whole shebang. She had to undergo a battery of tests that she gets them every 3 months, and one was a CT scan. All the scans, everything else was normal. She had 0 symptoms, but the scan was read evidence of pancreatitis, which means a guy or a woman in a room looking at a flickering screen in the dark with one line of clinical information. The senior oncologist was away, which is a pity because she's a very smart woman. So she was basically followed by the underlings, all young. And they scared her. They said, this is serious. You need to cancel the trip. We'll have to do a lot of studies. I said, Gretchen, this is not serious. This is a vomit. The British have coined this acronym. You are a victim of modern imaging technology. So let's go to Italy, forget about it. When we come back in a week, you can have all the studies that they want. But they scared her, so she canceled the trip. 5 days later, the senior oncologist came back and told her, don't worry about it. So it's always a problem when the tail wags the dog, when clinical skills and good critical thinking depend on technology. That means you got to be comfortable with ambiguity. You don't want to get anxious when confronted with uncertainty. Do it Leonardo style. Leonardo hated sharp lines to the point that he invented sfumato, that smoky background. And when he went to France to die there, on the back of his mules, he put the painting of an androgynous woman with a perplexing smile and the painting of an androgynous man with a perplexing smile, because Leonardo was convinced that the soul is androgynous. And when he died, he kept them at the bedside. He was perfectly at peace with ambiguity. Tolerance for ambiguity means you're open to new ideas, new perspectives. It means empathy, cooperation, cost savings. It means a primary care career and correlates with creativity. Hence, it's a fundamental trait. When he was about to go to Hopkins, Osler told the Penn students, a distressing feature in the life you're about to enter is the uncertainty that pertains not alone to our science and art, but also to the very hopes and fears that make us men. In seeking out the absolute truth, we aim the unattainable, and we must be content with finding broken portions. Now, Gail Geller at Hopkins said, we got a scale, let's leave them out. When they apply to medical school and they think in black and white, let's not admit them. True, but then as soon as they get in, we give them single best answer, black and white, multiple choice test, and we turn them into black and white thinkers. So we are part of the problem. Now, dealing with uncertainty, and I can tell you from personal experience, the last 3 years have been full of uncertainty, you need an umbrella. And what is that umbrella? You got to have a sense of humor. Now, Gandhi put it simply, if I had no sense of humor, I would long ago have committed suicide. Now, humor might be healing, especially the self-deprecating kind, because by putting ourselves down, we lift others up. It's the best way to curb narcissism, but in medicine, we discourage it. This is a paper written by a former colleague and chair of our family medicine department that as a medical student had been a stand-up comedian. And he loved it, and he used humor a lot, to the point that one time a little girl said, are you sure you're a doctor? You're too funny to be a doctor. And that is so sad. Now let's get back to Osler. Osler had a great sense of humor. He was a prankster, and children loved him. But one time he was whistling at the bedside, and a student said, Dr. Osler, why do you whistle at the bedside? Answer, I whistle that I may not weep. So humor has an undercurrent of sadness. And Mark Twain put it simply, the source of all humor is not laughter, but it's sorrow. There is no humor in heaven. Now, Twain lost 4 siblings before adulthood and then had to bury both his wife and 3 of his 4 children. So he knew that life is unfair. And in fact, it's even unfair that is unfair. And President Kennedy, that I adore, put it very simply. The man had received last rites 5 times in his life. And he was asked about life, and he commented.
There's always an equity in life. Some men are killed in a war, and some men are wounded, and some men never leave the country, and some men are stationed in the Antarctic, and some are stationed in San Francisco. It's very hard in military or in personal life to assure complete equality. Life is unfair.
2,500 years ago, Euripides put it simply, ours is a universe where justice is accidental and innocence no protection. I keep this picture framed at home to remind myself of that truth. This is a baby monkey still clinging to the body of her dead mother being carried away by the leopard that pretty quickly is going to eat them both. Hemingway, who had suffered a major head trauma during World War I to the point that he had a near-death experience, in Farewell to Arms, put it well. The war breaks everyone, and afterward many are strong at the broken places. But those that it will not break, it kills. It kills the very good and the very gentle, and the very brave impartially. If you're none of these, you can be sure it will kill you too, but there will be no special hurry. Now, is there a silver line? Today with Waldon, we were talking about the value of pain. And I think that is the silver line. Afterwards, many are strong at the broken places. So we're talking about wisdom. Now, Aeschylus, who actually had fought a marathon where he lost a brother, wrote in Agamemnon, even in our sleep, pain that cannot forget falls drop by drop upon the heart, until in our own despair and against our will comes wisdom through the awful grace of God. Now, that is a direct quote that Bobby Kennedy, the real one, not the travesty, the current one, the real one, actually put in a speech for the Martin Luther King commemoration when he got shot. But it's important because it reminds us that life adversity brings wisdom. And in fact, they should be welcome because they bring character. I'll give you some data. In a review of 700 famous historical figures, a fourth had lost a parent before age 10. 35% before age 15, and almost half before age 20, more than half before age 26. In a separate review of American scientists, the death of a mother or both parents was 3 times more frequent than in the general population. So if you want your kid to achieve wisdom, die young. Now, Horace put it simply, adversity reveals genius, prosperity conceals it. Now, I had a student recently that came to question every single item she got wrong on her physical diagnosis exam. Why? Because she was 1 point short of honors, and she was trying to get an honors. And in the end, it was clear that she was not. And she said, but it's unfair. And I said, life is unfair. Direct quote from President Kennedy. She went to the dean in tears saying, Dr. Mangione said that life is unfair, and the dean told me not to say it anymore. So with the Dean of Tampa, we wrote an editorial. Medical school has to give equanimitas. That was the greatest essay by Osler. And we're talking about the equanimitas of Stoic philosophy, which means the capacity to face unpleasant facts. That's a direct quote from Orwell. So what are we talking about? Now, Paul Fussell, historian, academic, and curmudgeon extraordinaire, reminded us of those exemplary unpleasant facts. Life is short, almost always ends messily. If you live in the actual world, you can't have your own way. If you do get what you want, it turns out not to be the thing you wanted. And 1 or 2 generations from now, you'll be entirely forgotten, and the world will go on as if you had never existed. Hence, you need the cheerful pessimism of the Stoic, as a physician for sure. And in fact, Gallen said the ideal physician ought to be a philosopher. Now, philosophia is a radioactive term here. Remember this clip?
What do you do?
I'm not sure yet, actually. I just graduated last spring.
And what did you study?
Philosophy.
Yeah, there's a good buck in that racket.
There is a good buck in that racket. And then there was him. Remember him?
Welders make more money than philosophers. We need more welders and less philosophers.
He's pretty happy with his little quip. Turns out that he's totally wrong. Philosophers make more money than welders. He was a philosophy major. And this guy, a gazillionaire, was a philosophy major. And so were all the CEOs. So when Rubio said that, he outraged the chair of the American Philosophical Association. They reminded him that when we talk about philosophy, we're not talking about toga-wearing thinkers. We're talking about critical thinkers. And good luck with critical thinking. Today, half of college graduates lack critical thinking skills, which means wisdom. And that has nothing to do with knowledge. So let me finish by saying, cultivate the philosopher within. And Osler was a philosopher. Penfield reminded us the life and philosophy of William Osler continues to serve as a standard of excellence and a model for the evolution of the profession and its practitioners. So let me leave you with some words by Osler. What's the job? To prevent disease, relieve suffering, and to heal the sick. That is our work. To have striven, to have made the effort, to have been true to certain ideals. These alone is worth the struggle. So gentlemen, farewell, and take with you into the struggle the watchword of that good old Roman Stoic, equanimitas. And that is what I mean by the art of medicine. And I think this job description reflects pretty much what Edward Livingston Trudeau, that created the sanitarium system in the US and in Canada, put in his writings, that we need to cure sometimes, to relieve often, and to comfort always. And to comfort, you need those soft traits, those intangibles. You need the fluff. So in summary, compassionate touch, eye contact, attentive listening, empathy, tolerance for ambiguity, self-deprecating humor, and ultimately a philosophy of life conducive to wisdom. If there is something I've learned in 50 years in medicine, that's pretty much it. So thank you very much, both to Waldon for the sweet introduction, to the president for inviting me, and I'm out of time. It's 1:45. I don't know if there is time for questions, but thank you very much for having me.
Question? Do we have questions?
I have a question. I can say without a doubt, this is one of the best talks I've heard in 25 years.
Oh, thank you.
No, and the point is, we share an ancestry. I'm a San Arcangelo. And what I want to say is, this is part, as you can see, this is part of what I'm trying to deal with. I've been lucky. I knew Dr. Spiro. I was at Yale. knew John Conley. I did all this. And in fact, I'm going to get a master's in philosophy in 3 months. I just want to say that this was terrific.
Thank you.
I want to keep in contact with you because I'm kind of like a silent voice, kind of doing my own thing, but we have very similar ideas. I'm a midget to your thing, but I'm happy to go along the journey.
Sure. Thank you. Thank you very much. Thank you.
The questions? There you go.
I want to say your words, your courage, and the fact that you could stand and say what's missing in healthcare. I've been in healthcare for over 40 years. I'm 70 years old, and I'm a nurse practitioner, and I now mentor new nurses. You're right. Everything is microwave. Fast, fast, fast. No touch, no eye contact, no empathy. Get that computer and get on it. And I'm trying to teach, we need touch, the right kind of touch. We need to respect one another. There is no color, there's no race, no ethnic, anything when you're taking care of patients. We need the time, and I know you all know that, but I just wanted to say this was so good.
Thank you.
Thank you.
Thank you for saying all of this. Thank you.
Thank you. And I have been there as a patient when the doctor didn't touch me, didn't talk to me, didn't diagnose me. What do we do to change it?
I think, and we were talking actually with the president just over lunch. I don't think it can be taught. I think we need to recruit them, that they have it. And so the question is, how do you figure it out? Because they can fake it. And then I think we need not to kill it. So it's complicated, but it has nothing to do with knowledge. Yeah.
Yeah, thank you very much. I, too, am in the 70th decade, and I agree totally with what you've said. I'm going to ask you, though, and put the shoe on the other foot. It's a changing world.
Yeah.
Economy does drive things. We do need the economic income. Science has exploded. Where do we blend these two?
Actually, I think there is another trait I did not talk, but it went into the paper. I have a friend and a mentor in many ways, and I asked him also, what is the ideal physician? Because I was asking that question a lot. He says the ideal physician is somebody who's trying to make the world a better place. Now, my friend is Jewish, and in the Hebrew tradition, there is the imperative tikkun olam, make the world a better place. So that goes back to the naming. Remember that the physician in those languages is a wise and cultured societal leader. And then if you look at the oath that we take, the Hippocratic Oath, the version that is mostly used in medical schools in the US, I remain a member of society with obligations to all members of society, whether sick or well, which I think means that we need to take charge. I think we still have clout, and I think we have a responsibility. But in order to absolve that responsibility, we need to push back. We're not providers. We are doctors. And then that, I think, is an important trait towards society, not towards the individual patient. So to answer your question, I think we need to get engaged. Yeah.
Please support our mission to improve quality of patient care through education. Join us, follow us, and share this content with family and friends.